Dr. Basu, thank you so much for talking with us this afternoon. During this pandemic, it is really a dangerous time for cancer patients. Explain why they're so vulnerable.
Sure. This is a dangerous time for cancer patients because cancer patients are intrinsically immunodeficient, meaning their immune system is compromised due to the cancer, and sometimes that can be exacerbated during if they're on therapy such as chemotherapy or radiation therapy. So I've spoken to many of our cancer patients and those from around the country that are very worried because they're confused, they're anxious, they don't know whether they should defer life-saving therapies versus any associated risks from the virus. And fundamentally, that's a question that nobody should have to answer alone. So really want every patient to be contacting us or contacting their doctor if they're not one of our patients to work through those questions, because the risks of putting off therapy could certainly be much greater than any associated risks from infection.
It could be argued that cancer patients who are going through treatment at a community hospital may be at higher risk because those hospitals are treating COVID-19 patients. Would you agree?
Yeah, I think the healthcare system right now is going through a couple of different crunches. One is that a general hospital system right now, unfortunately for the country and for society, is as we all know, is being flooded with the COVID-19 patients. And so I was actually just talking to a fellow hospital CEO recently who said, yeah, going to a cancer specialty hospital is probably the right place for a cancer patient to go, as opposed to a level one general hospital that is in the business of treating COVID-19 patients. So really, what we're trying to do is remind people that for we're excelling at treating cancer and cancer patients only, and working with our brothers and sisters in the healthcare ecosystem so they can focus on treating the infections.
I was going to ask you, how exactly can a specialty hospital like CTCA help?
So in a few ways, we can be very helpful to the macro system and we've already begun to do this we have capacity and very well trained doctors and beds that we can take transfers, or a cancer patient who right now might have to defer a surgery or defer a chemotherapy, or even an appointment, and we can have those patients come to us in a cancer specific only environment where we're dedicated to preserving their therapy and their safety. And in doing so, we can relieve capacity for another hospital to take care and focus on their COVID-19 patients. So really, that is kind of the best of both worlds. And what it can do, Karen, is to prevent what I sort of refer to. We talk about flattening the curve. Well, people are not really talking about flattening or the second curve with respect to cancer. And a lot of patients in non-COVID-19 categories, including cancer patients, are getting pushed back. And our solution is one that can really help individual patients and the American healthcare system.
This really is such an unsettling time. I would imagine knowing that a patient has the option of going to a specialty hospital where that's just your sole focus would really give them some peace of mind right now.
Yeah, going to a cancer specialty hospital really right now, it gives them peace of mind for a few reasons. Cancer is a disease of the mind as much as it is the body. So as a colleague of mine says, in cancer, waiting is suffering. And we've been telling patients the bread and butter therapy to cancer is early, consistent, and finish it off. So we can't just all of a sudden tell patients to not come in, number one. Number two, coming to a place that only does cancer, and that's all that we do is certainly the place to be. And then number three, it allows a separation of patients and a separation of therapy so that we can only focus on cancer and not have those patients be exposed to the pandemic of COVID-19 that our other hospitals are helping deal with.
Well, managing the bills for cancer treatment is always top of mind for many patients. Can CTCA help them navigate the insurance quagmire, if you will, that might come with moving from their in-network hospital to an out-of-network hospital?
Yeah, that's a great question. We're working with every insurance company around the country and certainly there in Oklahoma to try and do just that. We, as you know, see patients from all over the country and patients come to us from great distances. So we're working with other providers to say if we can get a patient in at a closer facility or location so they don't have to travel as far. And we're really working with insurance companies to try and loosen some of those restrictions. Specifically there in Oklahoma, we're hoping that some of the insurance companies can really lock arms with us and allow a patient who might not have otherwise been able to come get safe, timely care to do so during this crisis. So I implore, the Blue Cross Blue Shields of Oklahoma and other insurance companies there to allow their patients to do that during this crisis.
Absolutely. Any final advice, Dr. Busse, that you would give to cancer patients and their caregivers during this time?
Yeah, just to add some perspective, this year alone in the world, 9 million patients, unfortunately, will die from cancer. Here in the United States alone, that number will be about 700,000 patients. Cancer is the definition of a life-threatening illness that affects so many people. So I would just remind everybody that cancer does not and cannot.
With the governor's executive order closing non-essential businesses, some are wondering what that means and why certain workers and industries are considered essential. Our Travis Guillory answering questions from our coronavirus problem solver line on why Oklahoma toll collectors still have to report to work.
There are so many essential businesses that are still open within certain industries that deal with hundreds, if not thousands of people every single day. For instance, turnpike toll collectors.
People travel from all over the world through there, and we are in this booth that is open constantly. We handle all kinds of money. We're in contact with coughing and sneezing, sick people. And we have to stand in the booth for like 6 hours at a time sometimes.
And some wonder why the tolls don't just shut down altogether. Another viewer messaged us saying, I'm wondering why a turnpike toll collector position is considered essential during the coronavirus crisis. It seems to me that exposure to thousands of people traveling from various states is not smart. So I reached out to the Oklahoma Turnpike Authority and they said just as the traditional gas tax continues to be collected at gas pumps to facilitate the operation and needed capital projects on the state highway system, the Oklahoma Turnpike Authority maintains its collection of tolls to manage the turnpike system and to continue to honor its contractual obligations that in turn help with Oklahoma's economy. Some of these obligations include road maintenance employees, highway patrol troopers, vendors, and independent contractors who employ road crews that ultimately rely on OTA to make payroll. And when it comes to what OTA is doing to help protect their employees, they say that they're putting up signs that only one person is allowed in the booth at a time. They're offsetting shifts to avoid any employee overlap. Any sick employees have to be symptom-free for 72 hours before returning to work. All collectors have to wear gloves, and they've increased breaks for more hand-washing opportunities. And if there's a question that you would like me to look into, just give us a call to our Two Works For You Problem Solvers Coronavirus Hotline. The number you see here, 918-748-1502, and I'll do my best to get you the answers that you need. Travis Guillory, Two Works For You.
Well, local restaurants are trying to keep their spirits up as business goes down. Our Katie Kelleher finds Cafe Olé in Brookside here in Tulsa is working through the coronavirus pandemic.
It's still stressful to know that you have imminent doom over your head, but I'm a millennial, so we're used to that.
Jada Teehee has worked at Cafe Olé for nearly 9 months.
This is probably like the first serving job that I've had where I actually have enjoyed being a server. And I enjoy the people that I work with too.
She never expected something like this to happen. She says she usually makes really good money, but now must be tight with her budget, especially as the end of the month bills draw near.
This cock's gonna cut my internet off. ONG, PSO, gas, insurance, car, tags, all of the bills.
the popular Mexican restaurant has been open since 1987. While business has been down, co-owner Luke Bryant says they're trying their best to keep staff employed, and their number one goal right now is the well-being and safety of their employees and customers.
It's tough to find the silver lining, but we're trying to do it. Trying to stay positive and keep great employees and keep trying to do our part for Tulsa.
Both say they've seen strong support from the community and their regulars, and they're going to continue supporting each other through this pandemic.
If you can't control it, then leave it be. So that's kind of where I'm at with this situation now.
Cafe Olé is offering to-go and delivery services, plus they're offering gift cards at a 20% discount. They say it's a great way to support them. If you know another local restaurant or business we should highlight, let us know at our website, kjrh.com. In Tulsa, Katie Kelleher, 2 Works for You.
A company in Claremore is fighting the virus by manufacturing a key material that is badly needed to make masks for healthcare workers, nanofiber. 2 Works for You's Sierra Pizarro shows us how the company redirected its production line to tackle the desperate need.
So that material right there is for face mask.
It's 1,000 times thinner than human hair, though the finished product stands at about 4 feet and weighs 400 pounds.
But this is a smaller sheet of it. This is what eventually gets molded into a mask. The fibers in here are so tightly woven together, not even a cough drop can get through this.
Not the ones for colds, respiratory drops. That's how COVID-19 spreads, through droplets we cough and sneeze.
And the nanofiber is what brings it up to 95% efficient at 0.3 microns, which is extremely small. The average particle size for the virus is around 0.1 to 0.2 microns.
When magnified 2,000 times, you can see the tightly stitched nanofibers. They're used for a lot of things. Right now, it's really needed to fight the coronavirus.
When people, including first responders and hospital workers, are reusing masks or trying to find a way to sanitize a mask to keep themselves from being exposed, they're putting their lives at risk.
To help the world, this team got to work.
Our goal is to produce up to 5 million face masks worth of material a week. Right now, we've already produced 500,000.
30 employees rotate around a new 24/7 shift. The rush started last week after at least 400 incoming calls from clothing companies, local, state, and government officials, and
a lot of international phone calls, people trying to find any material they could to be able to make the N95 masks or surgical masks that are in short supply right now, of course, throughout the globe.
N95 is a respirator rating. The N means not resistant to oil, but N95 masks are almost 100% resistant to airborne particles. Next Nano's material meets that standard. Now they wait to find someone to ship it off to.
We're able to do the fabric part. We need somebody else to be able to actually make the mask.
One vital part made here in Oklahoma. I'm Sierra Pizarro, 2 Works for You.
The U.S. House farmers are starting to feel the impact of the coronavirus. They tell us they're seeing a drop in sales while still trying to recover from last May's flooding. Our Tatiana Taylor introduces us to one farmer who lost nearly 3,000 acres of grain and wheat last year and is now trying to overcome a whole new hurdle.
It's stressful, but we'll make it work.
Darren Perry farms about 3 acres of land in Fort Gibson. After last May's flood, he lost nearly all of his crops. He wasn't expecting anything like the coronavirus to hit farmers this year.
The future markets are down, and that's what we have to go off of. So that's what we're seeing as grain markets across the board are slowing down.
Perry says farmers are also concerned about the potential for another May flood, with mild to moderate damages this spring.
Yeah, it'd be a double hit, but for us, we're more worried about the flood. The amount of rainfall we're getting is making it very challenging for farmers to getting their fertilizer out, the herbicides out. So the crops are kind of tough, or taking a beating from the rain, and it's putting everybody behind.
Although he has plenty to be concerned about, he will continue to be optimistic.
It is stressful, but farming, you got to be optimistic. Tomorrow's going to be a better day, and farmers across America are going to get up and try again, and they don't have quit in them.
Anthony Helsey agrees. He's been farming for the last 10 years. He says he tries to roll with the punches.
I mean, if we could see prices back to where they were, 2010, 2012, it'd be be amazing for the farm.
His biggest concern isn't the virus or possibly another flood. It's years of declining crop pricing.
Commodity prices haven't been hit tremendously yet from the coronavirus, but we're not that far into it yet. So we're just kind of a wait and see deal right now.
Tatiana Taylor, 2 Works for You.